a bi-jaw surgery for him. That is Le Fort 1 superior impaction, and also we have done lower jaw surgery. Second day following surgery, so we had done bimaxillary surgery for him.
The incisor show has reduced to half 4 mm and pushed upwards and then plated. So this was the pre-op, this is the post-op.
The 37-year-old male patient Bandi Chandrasekhar Rajshekhar. So today is his first post-operative day, and we have done a bi-jaw surgery for him. That is Le Fort 1 superior impaction, and also we have done a lower jaw surgery for him. He had come here with the chief complaint of bimaxillary protrusion. So that was proclined upper and lower incisors, and he had a incompetent lips. Can you close your lips? Okay. So he had to forcefully close the lips before he had mentalis hyperactivity. As you can see here, there's no hyperactivity which is noted now, and he's able to close the lips without any force. And these are the pressure pack, the dynaplast that are intact. There is edema all around, as you can see. Because it is the first post-operative day, we can expect the swelling. How do you feel about the swelling? Okay, you have any pain? It's tolerable. Okay, it's tolerable pain, right? Okay. And then patient also complains of paresthesia because of the surgery and edema. There will be little amount of paresthesia which will gradually settle down. And can you bite? Yes. Okay. His occlusion is also satisfactory. And what are you having? Food?
Juice.
Okay.
Juice, coconut.
Okay. So we have done bi-jaw surgery. We usually advise liquid diet for patients for first few days, and slowly they can convert for a soft diet in future. This is his second day following surgery. So we had done bimaxillary surgery for him. So surgery in both upper as well as lower jaw. So as you can see here, from yesterday the swelling is reduced a little bit. Sorry, what happened?
Genoplasty also.
Yeah. So there's a little bit of swelling around the operated site, which is resolving. From yesterday it has been reduced a little bit, and the patient is also active when you compare from the yesterday's video. So how do you feel today?
Feel good.
Better than yesterday?
Better than yesterday.
Okay. How is pain?
Don't get it.
Absolutely. So the patient is saying he has no pain. That too after a bi-jaw surgery. It's just his second day. Yeah. Then.
Today morning I did brush also.
Okay, good. That's good. Okay. So you have to be gentle, okay? Because there are fine sutures.
Yeah.
You have to be gentle.
Use
Okay.
that.
Yes, good. Okay. Then food, for what are you doing for food?
Still now is there.
Okay.
So take it only fruit juice.
Fruit juices.
and,
Okay. Okay. Is it available here or ordering from? What are you doing?
everything.
Here only. Okay. So the patients usually get the food whatever they like in the hospital itself. So this patient, he has also, has come alone. So that's one thing which you have to note. So the patients, when they come here, we arrange them everything. So time to time they'll get all the medicines and food. So it is not going to be a problem for the patients to stay here after surgery. Okay. So drink lots of water. Okay. Keep the area clean. You'll be good. Okay. Today is his third post-operative day. As you see, he is very active. He is walking around, and swelling is also reduced a lot. And so these are the pressure pack which is intact, and the swelling around the lips comparatively reduced from yesterday. And how do you feel today?
No, now less completely numbness gone.
Oh,
Except
numbness
some-
is resolved. So this you have to note. The patient usually complains of numbness, and this is his third day, and he's saying that numbness is not there, and he has the sensation which has improved a lot.
Only
Okay.
on the nose I have numbness.
Okay.
Here it's completely.
Okay. So what about the pain?
I don't have pain.
Yes. So this is his third day, and he's telling there's no pain because we are giving him intravenous injection. So usually people will think whenever there is byjaw surgery, there will be a lot of pain. No, it is not. So only he has little bit of edema, and it is resolving every day. So what about food? From where you are ordering?
No, still a year old.
Okay, so from the hospital itself, you are having the food and everything. Okay. You have any other complaints? Any
No
other?
problem. Right now it is getting tightened.
Uh-huh. Okay, okay,
Inside, I'm feeling like it is getting tightened.
okay, okay. Other than that,
No problem.
no other issues. Okay then.
Alright, so here we are on post-op day 6, and this patient is all set to go home following a byjaw surgery. When he came to us with a gummy smile, a proclined incisors. Now, can you just smile? Yeah. So now when you see his teeth show, it's only half the central incisors that you can see. The incisors show has reduced to half, whereas before it was more of a 3 mm gummy smile, that is the gums 3 mm part of the gingival portion could be seen along with the teeth. And how we have done that is, we have done a Lefort 1 superior impaction, meaning this portion, this part of the upper jaw has been superiorly impacted up. Some amount of bone has been taken off from here, about 4 mm, and pushed upwards and then plated. So this was the pre-op, this is the post-op. You can see the fixation of 4 plates on the upper jaw. Now moving on to the lower jaw, he had a broad chin to begin with, and you can see how strong all this bone looks like. What we have done is we have augmented it more in the horizontal dimension, and you can clearly see it in the scan. So this is the chin, which has been brought forward and secured and fixed with plates. So you have 2 plates here and 4 screws, and you can see how this is merging with the lower border of the mandible posteriorly. So all of this area that you see now, which is empty, is going to be filled by bone in due course of time. This patient need not as such come back for a follow-up or a review, but if you get a chance, if at all you're coming by nearby, you can drop in, or else you just send us your photos. Okay.
Yeah.
So his bite has also been maintained. One thing to note is that although we do mock surgeries for such cases, we do it just to maintain the bite, to secure the splint in that position, and then we fix the plates. So every procedure has been done accurately, both in the upper and lower jaw, without disturbing his bite, and he has no functional issues as of now. And are you having any pain?
No pain at all.
No pain at all. Some numbness?
Numbness is there on the nose, on the lips.
Yeah.
That's
So that happens because the mental nerves here, they get stretched, and here also in the infraorbital nerve will have some amount of I would say hypoesthesia rather than paresthesia. The upper jaw should be fine quite soon as compared to the lower jaw. The lower jaw will take maybe a month's time to heal fully. But how was your experience? Are you happy?
Yeah. So I checked these videos in the YouTube, and then I came here. So initially, when doctor said that both surgery, bypass surgery, I was a little scared. So what would be the outcome of this one? So later, when I gone through that one, I got a lot of confidence. So one day after surgery, I went to the ICU, then immediately general ward. Next day onwards, I was able to feel normal. I did not face any kind of problem like pain or any blood, nothing. So everything was fine.
Okay, so everything went smooth.
Yes.
Okay, we're glad. And yeah, you should be fine. The sutures will resolve in 30 to 40 days. So nothing to be worried about. Be on a soft diet for a period of 1 month. After 1 month, you can slowly, go to a hard diet. But just try to keep it soft for 1 to 1.5 months and then regain your old diet back.
Sure.